The state's health department is out with a warning tonight after a Metro Detroiter comes down with a highly contagious virus. We're talking about the measles, and for the first time in 5 years, there's a confirmed case in our state. That story tops the news here at 10 o'clock. Good evening. I'm Kimberly Gill.
I'm Devin Skillian. Tonight, we've confirmed the sick child is in Oakland County. Mara McDonald live at Detroit Metro tonight because, Mara, that child had been traveling internationally.
That's right. That's what the health department is telling us at this point, Devin. They believe that child contracted measles overseas, got home, realized that the child was sick. That's the situation. So, of course, the question becomes, what's the exposure? The state health department is hoping that it is contained. The last time measles was in Michigan was in 2019, and it created serious problems. More than 40 people were infected, ranging in age from 8 months to 63 years old. To give you an idea of how wildly infectious measles is, we turn to Dr. Gretchen Snow-Boss-Newman, infectious diseases expert at the Detroit Medical Center.
It's one of the most infectious viruses that we have. There's a measure that we use called R0, which is the number of people that any one person with a disease will go on to infect. For something like flu, it's between 2 and 3. For measles, it's 19.
Think about that. And we all know how easy it is to come down with the flu. It makes you realize how at risk those unvaccinated are. And if you look at the statistics from the state on our vaccination rate, it hovers between 83 and 84%.
It's lower than it was, and it's concerningly low. Pediatric infectious disease doctors, pediatricians, and the public health community at large have really been trying to ring this alarm since before the pandemic, but certainly in the wake of the pandemic, where we're seeing decreased rates of childhood vaccination, and measles is the anchor of childhood vaccination.
Why doesn't that 83 to 84% cut it? Well, because the virus is so infectious. You need to be at 90% coverage for herd immunity. We're not there. While the hope is this current case can be contained, the state health department is recommending anybody 1 and over get vaccinated. Something else to consider: the vaccine is effective within 72 hours of exposure. Back here alive, and one thing that doctors always want people to know, that lack of insurance or financial problems should not be a barrier to getting this vaccine. If you don't know what your vaccination status is and need some help, you can call your local health department. They can get you a vaccine if needed, and they can come up with grant monies and other things that can help get you assistance. So don't let money be a barrier here is the whole point. Devin, Kimberly, we're live at Metro. Back to you.
Really something. All right, Mara.